Hi, this is Dr. Lou D'Amico at the Chippewa Chiropractic Clinic, and it's New Year's. And so what happens at New Year's? New Year's resolutions. What's one of the most common New Year's resolutions people make? I have to do something with my weight. Whether it's 10 or 15 pounds or 100 pounds, what we know is this. As we build what's called central obesity, in other words, as we get bigger around the waist, our chances of developing some terrible things skyrockets. What do I mean by terrible things? The big four, the things that cost $1.5 trillion a year: cardiovascular disease, diabetes, stroke, cancer. If you know anybody with diabetes or you're suffering from diabetes, you know it changes your lifestyle. There's a lot of things you got to watch now. And same thing, cardiovascular disease, blood pressure medication, statin drugs, these things all have terrible possible side effects. Thank God they're there to help us, but ultimately the bridge is if we can reduce this central obesity, if we could find a way to bring this central obesity down, we become less reliant on these dangerous drugs, and we reduce our risks of developing some of these chronic diseases, as well as becoming more active. Because if we're carrying a lot of weight, it hurts to walk, it hurts our knees, it hurts our hips, it hurts our feet. If we've got arthritis developing in there, it compounds the pain. And so we almost become trapped in our own body because we can't even exercise now to lose weight. So this is a very touchy subject, I know. I don't take this lightly. These comments come from my heart because I deal with friends and family and patients on a daily basis who struggle with this. We have some solutions at our office and that help people move towards a higher level of health. There's a lot of other programs out there that can help you become healthy. I'm not saying ours works for everyone, but the bottom line is the first thing you have to do is look yourself in the mirror and decide whether or not you want to take this journey, because it's going to be a tough journey and there's going to be ups and downs and you need a coach to help you through it. But ultimately, if you can control this central obesity and reduce it, you're going to lead to a much higher level of optimal health. We're starting a little series here. We're going to talk about more of these things later on. Just wanted to introduce this concept to you. Thank you for listening.